I think one thing that in the upper airway space people talk about too much is forward head posture. Really, that's only one strategy that I see, and I would argue that that's probably a better strategy for people to use than the person who uses a military head posture where everything's pulled way back. Because if you think about it, what that does from to the upper airway is it's going to compress it anteriorly and posteriorly, or front to back. So it really limits the degree of excursion that can occur when someone's breathing. And so, but some people, again, to deal with the stressors that they have to deal with and to be able to breathe effectively, may utilize that strategy to deal with structural deficits or an inability to manage some of the stressors that they have to deal with. And so you can see widespread effects due to a multitude of factors. Now, the question is like, did the structure cause this or vice versa? And that's something we just don't know. But what I will say is the cool thing is a lot of times you can have less than desirable structure, but addressing many different conservative strategies, whether that's maximizing dynamics, not just of the upper airway, but the lower airway, meaning do I have adequate range of motion to allow me to move the ribs, move the pelvis, move basically everything that I need to be able to get good gas exchange, as well as working on various postural things, which we'll talk about. That can still lead to profound improvements in someone's health, well-being, breathing, sleep, without necessarily having to make major changes to the structure. One thing in my domain that we talk about a lot is how much structural changes are actually related to pain. If you look at a lot of research in terms of like imaging findings, MRIs of say lumbar spine, shoulders, knees, etc. In asymptomatic people, depending on what age range you're looking at or what body area, anywhere from 30 to 80% of people can have abnormal findings on imaging who don't have pain. And so you have to wonder, if that's the case, do we have the same thing when it comes to sleep disorders or breathing issues? You might have people who actually do pretty well in that domain, but still have poor anatomy. And so my point by bringing that up is there's a lot of uncertainty in terms of how well these things, these structural issues, relate to the problems that one deals with. And I think the best course of action is to try and exhaust all conservative measures for as long as humanly possible before you go altering the structure, because you don't know to what extent the structure is actually influencing what's going on.